Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Symptoms of dehydration in adults older than 65. Dehydration affects 20% to 30% of older adults and is usually caused by insufficient water intake. It may also be caused by excess water loss through diarrhea, vomiting, sweating, high fever, or side effects from medication. /r/n/r/n Dehydration occurs when a person loses more water than they take in. Water serves many purposes in the body, including producing energy, optimizing brain function, regulating body temperature, ridding the body of toxins, and lubricating joints. /r/n/r/n This article reviews dehydration in older adults, including symptoms and signs to watch out for. Rehydration strategies and insight into why older adults are more vulnerable to dehydration will also be provided. /r/n/r/n Tan Getty Imagesrnrn Symptoms and signs of dehydration in older adults include the following. /r/n/r/n Constipation or straining during a bowel movement is a common sign of dehydration, as water softens stool, making it easier to pass. /r/n/r/n When dehydrated, a person's urine turns dark yellow, indicating it is more concentrated. Urinating less frequently or noticing a smaller urine volume when using the bathroom are also common. However, the presence or absence of these urine symptoms is not reliable for diagnosing dehydration in older adults. /r/n/r/n Cognitive performance is affected in individuals with more than 2% body water loss. Areas of cognition most affected by dehydration include /r/n/r/n Dehydration can also affect mood. /r/n/r/n In one small study, adults who were habitually high-volume water drinkers, 2 or more liters of water per day, reported diminished feelings of contentedness, calmness, positive emotions, and vigor after decreasing their water intake. /r/n/r/n In another study of older adults, malnutrition along with dehydration due to low intake of fluid was associated with the following mood changes. /r/n/r/n Dehydration in older adults is associated with muscle catabolism when the body favors muscle breakdown as a source of energy, as opposed to carbohydrates or fat. /r/n/r/n Dehydration can also cause electrolyte imbalances. Electrolytes are charged minerals in the body, including sodium, potassium, and calcium. /r/n/r/n The combination of muscle catabolism and electrolyte imbalance can cause muscle weakness, aches, cramps, twitches, and spasms. /r/n/r/n Other potential symptoms of dehydration are /r/n/r/n In severe cases of dehydration, hyponatremia or hypovolemic shock can develop. /r/n/r/n Hyponatremia is characterized by elevated sodium levels in the bloodstream. In older adults, it's often caused by severe or prolonged poor water intake. Symptoms can include weakness and irritability, progressing to muscle twitching, seizures, coma, and potentially death. /r/n/r/n With hypovolemic shock, a person's blood pressure becomes so low that oxygen delivery to vital organs is impaired. /r/n/r/n Symptoms of this potentially life-threatening condition include /r/n/r/n Older adults are vulnerable to dehydration for various age and health-related reasons. /r/n/r/n As adults age, they are at a higher risk for dehydration due to these phenomena. /r/n/r/n Older adults are also more likely to have health conditions, such as diabetes or an enlarged prostate, that may cause them to wake up at night to urinate, nocturia. To avoid disrupting their sleep, they may purposefully drink less. /r/n/r/n Those with urinary incontinence are also prone to dehydration. They might restrict themselves from drinking to avoid having an accident. /r/n/r/n mobility issues or severe joint diseases, such as osteoarthritis, progressive disease that causes a loss of protective cartilage around joints, can also make it difficult to access water independently. /r/n/r/n dementia comprises a series of conditions, for example, Alzheimer's dementia and vascular dementia, associated with brain changes that cause cognitive decline. Age is the strongest risk factor for dementia. /r/n/r/n with dementia, a person may forget to drink or have difficulties communicating their thirst to caregivers. Psychological effects of dementia, like depression, apathy, or agitation, can limit participation or interest in mealtimes or activities where drinks are served. /r/n/r/n dementia can also reduce a person's sense of smell and taste and cause motor, movement-related, problems like difficulty swallowing. These physical changes can impair adequate hydration. /r/n/r/n individuals with dementia are 10 times more likely to be admitted to the hospital for dehydration compared to adults of the same age without dementia. /r/n/r/n dehydration is classified as either acute or chronic. /r/n/r/n chronic dehydration in older adults is linked to several adverse health problems, including falls, constipation, urinary tract infections, UTIs, worsened memory performance, and an increased risk of being hospitalized. /r/n/r/n moreover, if an older adult, 65 years or older, is hospitalized for another reason, dehydration can lead to a poorer prognosis, outcome, for the condition being treated. /r/n/r/n dehydration is treated by restoring the water content that has been lost. Older adults with mild dehydration who can drink independently can usually rehydrate at home. /r/n/r/n severe dehydration requires hospitalization with intravenous, through the vein, fluids and, sometimes, other measures, depending on the underlying cause. /r/n/r/n talk with a healthcare provider if you are uncertain about the severity of your, or your loved one's, dehydration, or if you have underlying health conditions, like kidney disease or heart failure, that may require medical monitoring of fluid intake. /r/n/r/n rehydration at home requires taking small but frequent sips of water containing electrolytes such as sodium and potassium. /r/n/r/n oral rehydration solutions, ORS, are available at local grocery stores or pharmacies. These solutions differ from sports drinks, Gatorade, in that they contain the correct amount of electrolytes needed for rehydration. /r/n/r/n keep in mind that ORS is contraindicated in those who have severe dehydration, are unable to drink liquid, have prolonged/severe vomiting, or have an intestinal blockage or ileus, slowed or stopped intestinal motility. /r/n/r/n while rehydrating, it's crucial to be seen at a hospital emergency department if symptoms of dehydration continue despite drinking fluids. /r/n/r/n likewise, contact a healthcare provider or seek medical care if the cause of dehydration, for example, vomiting or diarrhea, persists. Medicine to ease the vomiting or diarrhea may be needed. /r/n/r/n call 911 or go to your nearest emergency room if you have /r/n/r/n oral rehydration solutions and intravenous, fluids can be administered at a medical facility. They are generally administered at a rate based on body weight. /r/n/r/n during rehydration, a person's hydration status is closely monitored by evaluating various factors, such as urine color and concentration, heart rate, blood pressure, and changes in body weight. /r/n/r/n the recommended water intake for females is 1.6 liters per day and 2 liters daily for males. /r/n/r/n. However, this recommendation is not a hard and fast rule. A person's fluid needs may be lower or higher based on underlying medical conditions and activity level. /r/n/r/n tips for preventing dehydration in older adults include /r/n/r/n tips for preventing dehydration in older adults living in long-term care facilities include /r/n/r/n dehydration occurs when a person has insufficient water due to poor intake or excess loss, for example, vomiting or diarrhea. /r/n/r/n older adults are prone to dehydration for many reasons, including a diminished sensation of thirst, medication side effects, and health conditions like diabetes, enlarged prostate, or arthritis. /r/n/r/n dementia is another major dehydration risk factor in older adults due to its cognitive, for example, forgetting to drink, psychological, for example, loss of interest in drinking, and physical, for example, problems swallowing, effects. /r/n/r/n symptoms of dehydration in older adults include constipation, dark-colored urine, difficulty paying attention, irritability, muscle cramps, dry mouth, fatigue, and weight loss. When severe, dehydration can cause symptoms of shock, including confusion, fainting, poor skin elasticity, and a fast heart and breathing rate. /r/n/r/n mild dehydration can usually be treated at home with oral rehydration solutions. For severe dehydration or in scenarios where a person cannot drink liquids or has health conditions that require close monitoring, for example, protracted vomiting or kidney/heart failure, hospitalization with 4 fluids is necessary. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.